Life. Hi, guys. This is Dr. Rajiv Sharma. I'm a board certified gastroenterologist. And I just felt that at this time, there is still lack of awareness amongst the general public about colon cancer, colorectal cancer, and there's a lot of myths and a lot of misinformation which is circulating out there. So I felt that I talked to my good friend Tiffany Heklinski today, and together, her and I, we're going to try have a conversation and see what we can do to educate the community, the families, the patients, the caregivers, physicians, nurse practitioners, healthcare facilities, senators, legislators, everybody that is out there to see why it is critical to get colon cancer screening done and what options they have available. We also going to talk about as to colon cancer is rising in incidence now, and younger people are getting it too. And Tiffany will share her story as well as other information about that as well. So definitely, this is a conversation coming from directly from the heart. I'm a physician who takes care of these patients, and Tiffany, she's an ambassador for Colorectal Cancer Alliance. I'm sorry, ambassador for Colon Cancer Alliance for awareness, and at the same time, she's also a survivor and has been blessed where it was caught early thanks to her efforts and the efforts of the healthcare providers that took care of her. So I just want to have a chat today very openly and just have a very open chat. So this is a public service and awareness campaign. It's not sponsored by anybody. It's sponsored by our good hearted efforts for the community to make sure people know that we can stop colon cancer if we are proactive. And blue is the sign for colon cancer. And this beautiful ribbon, this is a courtesy of Vadzim Kushnarku. I'm giving them credit right here. I found this on a public domain. So blue ribbon is the color for colorectal cancer. This is my lovely, lovely Tiffany. Met her about 4 years ago in Indiana. Mm-hmm. We became friends. She came to one of my lectures at IU Medical School, and she was sitting in the back listening, and she was a volunteer that day. And I met her just as a friend, heard her story, very heartwarming. And I think highly of her. And she's not a survivor. She's a warrior. She's a winner. She's a mother. She's a wife. She's a teacher, and she does a lot for the communities. Does a lot for education of the patients in the communities. So I'm so honored to be a friend and to know her, and I'm so thankful that she has given us time to share her story with us as well. So actually, I'm going to turn the mic over to Tiffany, and Tiffany, please just go for it. Just tell us your story.
Well, thanks for having me, Dr. Sharma. And you're right. It is young onset colorectal cancer in particular is near and dear to my heart. And the guidelines have stated now that colonoscopies are recommended for people 45 years age and younger. But even with that wouldn't have helped a lot of us. I was diagnosed at the age of 37. I was a perfectly healthy, for lack of a better term, working mother of 3 children at the time. My children were my oldest was in 7th grade. And then I had a child getting ready to enter kindergarten and a child getting ready to enter 2nd grade. And so, for those moms out there, they know what a crazy time that is. You're putting everybody, as moms know, you put everybody else before yourself, right? Especially your own health. My family and I had also recently moved from California to Ann Arbor, Michigan. My husband is a college football coach. And so when I would go into my primary care physician to say, I'm having pains in my side, I'm not feeling well. Just kind of this overall sense of ickiness, for lack of a better term. I was tired, I was run down. She would chalk it up to all of those kind of lifestyle things that we as moms deal with. 3 children, teaching, my husband has a stressful job, then we're moving. And so never once was it brought up that, oh, you might have cancer. It was, oh, maybe, you have irritable bowel syndrome, you have, maybe you have kidney stones. The misdiagnosis went on for about 10 months until finally the pain was so intense one day that I drove myself to the emergency room. My husband got home late from work one night in June of 2011. And I just said, I've got to go to the emergency room. And he's like, do you want me to go with you? And I'm like, no. Look, I'm going to go there. I'll get it taken care of. I'll be back before you even wake up. And when you know it, they got me in and to the emergency room, and they did an MRI, saw a mass, ended up doing a CT scan, and I went into emergency surgery that night where they took out a mass, part of my colon, and lymph nodes. And then 24 hours later, I was diagnosed with stage 3 colorectal cancer. So yeah, it happened that quickly. I mean, and I say it happened that quickly, but it had been going on for 10 months. But the surgery and the diagnosis happened that quickly. And that was something that was not even on my radar. It was, I'll be home in a few hours, to, my life changed forever. So, I think that's sad. I'm one of the lucky ones, because I'm will be 10 years from my diagnosis, gosh, in just a couple of weeks, which is crazy to think about. And I'm still here. And there are so many people that I have met through, my work or through support groups that are not with us anymore. And so, I'm lucky and I'm fortunate, because it could have been a whole heck of a lot worse. I live a quote unquote normal life. I still deal with side effects from colorectal cancer and the treatment, the chemotherapy and the radiation that I went through. And, I think it's just so important when people talk about getting a colonoscopy and they're like, oh my gosh, I have to go a day off of work. And I'm like, a day off of work? I know people who aren't even alive anymore. And so, I know that's kind of dramatic, but it's true. It's hard to hear that somebody doesn't want to give up a day of work when, I know people who would do anything to just give up a day of work. I lost a year of my life going through treatment. And these colonoscopies, gosh, I mean, I know it's not, I'm not going to say it's the most pleasant thing you ever experienced, but I'll tell you what, radiation and chemotherapy and surgery is a heck of a lot worse.
Absolutely. Tiffany, again, we're so thankful that you're still here to share your story. Mm-hmm. And you're lucky that you got caught early, because had you waited a few more months, God forbid, could have gone to the brain, the liver,
right.
Could have been worse. So, and that's what we tell people all the time, right? It's, if PrEP is the worst thing that happened to you, that's fine. But I'd rather drink PrEP and get diarrhea and stay off food versus the option, which is not being alive to even enjoy, enjoy your family or enjoy this earth, this life. So again, that's why we are talking today, because people who are nervous to get the colonoscopy, who are scared to get the colonoscopy, they don't want nothing shoved up their butt. Well, for whatever reason, I'm not getting the colonoscopy for whatever reason. They got to be educated. It's your health. It's an investment in your health. If you care for your family, if you care for your loved ones, if you want to stick around for many, many Thanksgiving dinners and Christmases, you have to take control, and you have to advocate for yourself. reach out and ask people, how can you get a colonoscopy? How could you get checked? I mean, you get oil change on your car, you get your iPhone updates, right? You get the new app, you spend time on your clothing, but the best thing in this world is your body. You ignore that, right? You cannot do that. It's not
Right.
acceptable.
Yeah, I completely agree. And, again, it is something that, like we said, it's not the most pleasant thing you're going to go through. But at the same time, the alternative is so much worse. And the other thing I think that's so interesting is that it's not like a mammogram where, as women, we get those every year. I just took my girlfriend to get her first colonoscopy just in April, and she doesn't have to go back for 5 more years. And she was like, "Oh, I had no idea. I thought I was going to have to do this every year." And I'm like, "No." I'm like, 5 years, this is something that as long as you don't have those comorbidities, if you're not if you don't have a family history, this is something that you don't have to get done every year. You can do this and then not have to get one for 5, or maybe you're the expert on that more than me, but you don't have to do this something every year. I have friends who are going just finished treatment, and we're like, okay, we've got to get one every year, and some of them are every 6 months, and it's like it's just once you do it once, I think people are like, oh, it's not that big of a deal. I think it's just the fear and the anxiety of going through it, but then once they do it, it's not quite as awful as it was. And you and I both know that the alternative is so much worse. And I just can't hit on that enough, because it is. I saw my daughter graduate high school, I saw my daughter graduate college, she has her first job. My sons, one's a sophomore in high school and one's in 8th grade, and I'm seeing them grow up, and there was a real chance I wasn't going to. And I know friends who aren't here now. And, it's just a colonoscopy.
Yep, absolutely. And as a gastroenterologist, we do this all day long, right? I do about 3,000 a year, and we are skilled at removing polyps, stopping cancer.
Right.
This is why I'm proud to be a gastroenterologist, because I can say to my kids and my colleagues, we stop cancer. It's not that we may stop cancer, we think we stop cancer. By removing that polyp, I know I'm stopping the seed for cancer. That's why I'm
Yep.
so proud and honored to be in this field. That's why, I'm so happy and thankful that I have this skill. And my other colleagues, my other GI colleagues across the country, they all deserve standing ovation for saving lives and working with patients like yourself, right? Which is a success story, even though, the beginning was sad, but the ending is so beautiful. You're right here, as beautiful as always, sharing your story, trying to educate people. So this is where, the value of colonoscopy and getting checked lies. It saves lives, it saves families. That's what I believe.
Oh, absolutely. It absolutely does. It saved mine.
Yeah.
And, I go in and get my colonoscopy, and I will drive you, whatever you want. I can drive friends. If people have questions, I'm more than happy to share with them my experiences, some tricks and techniques I know as far as the prep. Because like you said, colorectal cancer is preventable, and people like you, thank you very much.
Absolutely. No, thank you. As you know, I'm just going to share some facts with you and just have you
Mm-hmm.
comment on that as well. So every year, there's a lot of people getting cancer, and it's the third leading
Yeah.
cause of cancer-related death in America, and affects men and women equally.
Mm-hmm.
So that's something critical to know. It affects both sexes. And secondly, in 2021, we're supposed to have at least close to 52,980, close to 53,000 new cases of cancer-related death, colorectal cancer-related death. That's 53,000 families who will not have a loved one because of this cancer.
Yeah, and I think that's what's so important too, is that sometimes we think of colorectal cancer as an old man's cancer, right? That's a little bit of the stereotype, but it does affect women, and it does affect young women. I'm proof of that. And I just had a friend that was diagnosed at 32.
Wow.
It's stage 4, and has this beautiful little girl, and she just just unfortunately passed away about a month ago. And she was 32, and we're hearing it just younger and younger. And I wanted to share with you what we just received from the Colorectal Cancer Alliance. Some of the board members, we received this information, and it states that in a recent Journal of the American Medical Association publication, researchers predict that for the age group 20 to 49, colorectal cancer is estimated to become the leading cause of cancer-related deaths by 2030.
Wow.
So in just 9 years, ages 20 to 49, that's going to be the leading cause of cancer-related deaths is going to be colorectal cancer.
Wow.
And so it's so scary. And so I appreciate you getting this word out, because so much of that is preventable with colonoscopies. So much of that is preventable. So if you have any of these symptoms, be your own advocate.
Yep.
And I think that's something that I know you are a strong proponent of. I know, I was going into the doctor, I was saying, I don't feel well. And so, making sure that people understand, hey, it may be something more than an upset stomach or irritable bowel syndrome.
Yep.
It could really be this. And if it isn't, we can fix it. We can cure this, right?
Absolutely. Absolutely. No, you're right. When I practice, and this is how I preach as well, my father was a police officer, so we always think of the worst case scenario first. Okay, could this be cancer? Could it be life threatening? If yes, once you rule that out, there's nothing to worry about, because the last thing we want to do is, in this almost 22nd century, guess. Oh, this could be IBS. Oh, this could be something. We have to be absolute. We need to know, period. Just like I would say, if our iPhone is not working, if our car's not working, we take a car to the dealership. We take our iPhone to the repair guy. If our dog is not doing well, we take the dog to the vet and get the dog checked out. For God's sake, this is your body. That's the only one you got for this life. You got to keep it healthy. How could you ignore your symptoms? How could you not take care of yourself? This is what upsets me once in a while, because I care for people. We both care for people. We want to make sure they do the right thing. You have to get checked. You have to get screened, because by doing this, you're doing yourself a favor, your family a favor. Dr. Sharma, he's just there to help you and serve. You doing me a favor by letting me take care of you, but the biggest benefit is to you and your family. So you can go on trips together, see them graduating, see your grandkids and all, so we don't want to be a number right here like this, where, look at this, almost 150,000 cases going to be diagnosed in 2021, 150,000 cases. And then with the deaths and all, it's destructive to your finances, right? The medical bills kill you. The chemotherapy bills. I mean, the cost of treatment is in millions of dollars a lot of times. When you look at the surgical costs, radiation, chemotherapy, follow-ups, things like that. And then long-term damage from the surgery, from radiation, that could happen to you as well, right? And it's preventable by just one thing, which is open conversation, be aware of colon cancer, and talking to people like yourself who are advocates across the country who are promoting awareness. People need to listen that you got to protect your body temple. Your body is your biggest asset on this earth, not your iPhone, it's your body. Listen to your body, pay attention.
Absolutely.
Yeah. Absolutely. And again, this slide again, look at the lifetime risk of colorectal cancer. 1 in 23 men and 1 in 25 women. Look at that. It's this very high risk. It's 4.3% and 4% for women.
Right. Yeah. And I think that's what is so interesting, is that, again, it's that stereotype that it's an old man's disease, and it's not. Right? That women, we need to make sure that it's not just stress, it's not just our jobs, it's not just children, it could be something like colorectal cancer, and we need to be aware of that.
Absolutely. We, a few days ago, I actually performed a case on somebody who had belly pain. We found
Mhm.
lymphoma. We found lymphoma in the colon. Then a second case was a woman with breast cancer. So they actually had breast cancer mets to the colon. And I've seen
Mm-hmm.
melanoma in the colon. And then, especially if you have Crohn's disease or colitis, your risk of cancer goes up. So there's multiple factors too. And the biggest thing is family history, right, Tiffany? I mean, family history is
Right.
so critical.
It really is, and making sure that you're asking your family members. And one thing that we talk a lot about in our community is that it's it's not always polite dinner conversation, right? To talk about the things that we're talking about with colorectal cancer, and it can be difficult and it can be challenging sometimes to bring up symptoms you may be having to a parent or a grandparent or a cousin or an aunt. But it's so important to know, is there any family history? Are there family history, like you said, of GI issues, of stomach issues? What's going on in the family that people aren't knowing, that, oh wow, so and so did have colorectal cancer. I can't tell you the number of people I talk to that say it wasn't until I was diagnosed that I realized my granddad had colorectal cancer, or my uncle had colorectal cancer. And these are things that we should know. Just like we know when a mom has breast cancer,
Mhm.
right? We need to know if that mom or that grandma had colorectal cancer too. And so I know that, again, the topic is sometimes not polite all the time. That's kind of the Western culture we live in, right?
Mhm.
But at the same time, it's essential to find out.
Absolutely. Again, that's a great point, Tiffany. I always tell my patients, when you get together at family meetings and Thanksgiving dinners and all, if that's the only time you're going to see your family, well, make that a medical event as well. When you're passing over the
Mhm.
dinner roll, you can just whisper in the ear, say, hey, by the way, have you had any cancer, or anybody in the family has cancer?
Mhm.
That's a perfect time to ask for family history, because family history is so strong, such a strong factor for colon cancer, not just for one, but for other cancers too, right? If you have
Yes.
a genetic cancer syndrome like Lynch syndrome, or
Mhm.
FAP, or some other syndrome, Turcot syndrome, etc., you want to know what all cancers you had in your family, so you can at least assess your risk factors. And you
Yep.
have to pay attention to your family history. You got to pay attention to your mom and dad's brother sister's history, and assess your risk real time. It's a real time discussion.
Yep. Absolutely. Absolutely.
And no, thank you again for your thoughts so far. And I'm going to ask you a question about, you know, at this time, just the way the state of affairs is, and, for colonoscopies and post COVID, and,
Mhm.
job loss for people, etc. What do you think is the factor that affects people's perception for getting a colonoscopy? And secondly, cost. How critical do you think cost of the procedure is to cancer screening? What's your feedback as a cancer warrior? What can you share with us and the audience?
Yeah, I think definitely, one barrier to getting a colonoscopy is just the perception of how awful it is, right? And I know you and I have had that conversation numerous times I think you could almost say that it's downright fear, that people are just afraid of getting one. And so I think that's one barrier. And then the second one is insurance. Because again, if you are under the age of 50, most states, so it's a statewide decision, um, even though that there is a recommendation to begin the colonoscopies at 45, the insurance doesn't necessarily have to pay for that. And so unless you have a reason why you should be getting a colonoscopy, insurance providers may not approve that. In fact, I was interviewing one person through my PhD research, and his primary care physician said, well, we might as well just go ahead and get you a colonoscopy because, you're almost 45 and insurance will pay for it. And my question was, what if he had said it was going to be expensive? right? And then what would have happened? So he kind of like fell into this colonoscopy. I ended up getting diagnosed with stage 2. So he was, compared to the rest of us, he was pretty early on, pretty early in the process. And so I think that's something that we need to make sure that we're addressing too, is the fact that, insurance companies, aren't necessarily granting these colonoscopies to primary care physicians, or to gastroenterologists to make them cover. So I definitely think that it is definitely a barrier, is insurance not being covered. And again, just with the number I showed you, think of the amount of deaths that are going to be prevented. I don't know the exact cost of a colonoscopy, but I would imagine it's a heck of a lot cheaper than cancer treatment.
No, you make a good point, because we all want to do good for the community, for the patients, and it comes down to who's going to pay for it. And
Right.
right now, I know that if you have a screening colonoscopy, screening means we do a colonoscopy, we don't find nothing, it's clean. Insurance company has benefits that pay for it, so patients out of pocket cost may be nil to low.
Good.
Secondly, if you find something, then it may be billed as diagnostic. In that case, the cost to the patient may be a little high, because the insurance company may push it back to the patient saying, well, now it's not preventative. Now Dr. Sharma or the GI doctor found something, now it becomes diagnostic, and now it's therapeutic. So there's little clauses which you want to be aware of. And some people are like, well, Dr. Sharma, could you just say screening? Well, I can, but when we do the procedure, we find something medical legally, I have to document what I found. The billing happens accordingly, and depending what your benefits are, people need to be aware of the benefits by talking to insurance companies. But depending on what your benefits are, sometimes you may have to pay a little bit more than if I didn't find nothing, right? But even in the big
Right.
scheme of things, even if you have to pay a few $100s extra out of pocket for a diagnostic colonoscopy, which we did to remove the polyp, is still cheaper than cancer. So you
Absolutely.
have,
Absolutely.
yeah, our biggest thing is definitely cost is a factor. And there's some options about that. You can go to low cost center. We are right now, we are involved in multiple projects where I'm actually improving people's access to colonoscopy. We are working with some surgery centers, which are known as ASCs, or ambulatory surgery centers. They typically are
Mm.
cheaper than the hospitals, because normally hospitals have a higher facility fee, they have a higher cost of everything because they have a high overhead. But if cost is a matter to you, then definitely you can look at low cost option. Remember, quality is the same. It's same quality or better sometimes, but the
Mhm.
cost is low. So you can go to ambulatory surgery centers or ASCs, and you can ask your insurance company and ask your doctors, hey, can you do my case at an ASC? Could that be cheaper for the patient too? Number one. Number two, if you're self-funded, if you have an employer who's paying for your benefit, ask your employer, hey, do you have any preferred center of excellence? Is,
Mhm.
is there a place you prefer where they do great work, has a high quality, no complication rate, is also cheaper and affordable, right? I should not say the word cheap. It just sounds cheap to say the word cheap. I think affordable. Nothing in life is cheap. It's reasonable. My wife
Yes.
tells me that when my wife goes shopping, and I'm like, so how do you process this information? Like, well, nothing in life is cheap, is reasonable. I'm like, okay, reasonable, fine. So so
That's
reasonable.
it's yes, absolutely.
Yes,
And the other thing too, and if you do have a documented family history of this, that can impact your insurance situation as well. So this is really tied into knowing your family
yep,
history. Because if you can document that you have a family history of colorectal cancer, then all of a sudden that gives your provider a little bit more wiggle room as far as making sure that we can get it covered by the insurance. And I think that's, a great point, to overcome those barriers. Trying to minimize as many barriers as possible.
absolutely. I mean, your timing, everything is so in sync with my mind. It's like you almost felt the next slide coming, and you did. We are one team. We are home team. I'm a big
Yeah.
Rocky fan. I'm a big Sylvester Stallone fan. And in Rocky 3, he tells his son, "Home team. We are home
Uh-huh.
team. I'm your best friend. it's a physician-patient partnership because I have your best interest in mind. I want you to have a healthy, happy life. I want your family to not miss you, on the future dinners and all. I want you to win. So we actually have teams in place that will talk to you. They will look at the insurance benefits. They'll try to find you the low-cost option, and then we do something called pre-authorization, where we work with the insurance company to get pre-approved. So the more information you give us about your family history, the risk factors, that gives us more arsenal to fight for you, right? That's what we do. We fight for you so that you can fight for yourself. So we work with the payers and, Anthem and Cignas and Medicare. Insurance companies have been, they're very fair when you give them all the information they need. They've been
Right.
pretty helpful in doing that, especially, if we're gonna do your procedure at a facility which is reasonably priced and then also high quality, and we give them all the documents. It takes a few seconds to get an approval. And my operation manager, Mr. Vikram, is on as well. That's what his teams does. His teams, they do all the back end stuff to take your stress away. But again, it still takes some participation from your standpoint to know to ask the insurance company as to, hey, where shall I go? I'm due for my colonoscopy. What are my benefits? And also be mentally prepared that if we remove a polyp, your code may be different because before and after is different. That's just the insurance clause. But still in the big scheme of things, if you're getting a colonoscopy, you don't have cancer, you get a clean chit, you remove the polyps, you're good for 3 to 5 years or 10 years, it's a win-win. It means you can stick around your family, you can go to all the baseball games, you can go skydiving, bungee jumping, whatever you want to do, you are alive and well to do that.
Absolutely.
So, yeah, no, again, that's why, I love my job because we can stop, cancer. And again, people like yourself who are so kind to spread the awareness, really tell your story to people, to educate them and prevent families from being broken by this disease, which is preventable. I mean, every cancer is bad. Cancer sucks. Cancer is bad. Colon cancer is so preventable. Then there's other cancers like, esophagus, pancreas, liver, breast, uterus, ovary, brain, bone. All these cancers are bad. But I think once we get in the mindset that we need to get checked for cancer of one kind, automatically your body decides and your brain decides, you know what, maybe I should get checked for this and this and that. I'm not saying you go paranoid and think all the time, oh my God, I have cancer. But I'm saying it's good to be aware. Just like you're aware that your iPhone needs an update, that your car needs oil change, your body needs to be checked. And think of this like an oil change for the body. We have a checklist every so many years. Make sure you get your pap smears, get your mammograms, get your colonoscopy, upper scope, and pay attention to your body, guys. That's the whole idea. That's why I want to invite Tiffany to give her feedback on this. You have to pay attention to your body and keep your body healthy like a temple. And there's resources out there, such as American Cancer Society, Colorectal Cancer Alliance, which Tiffany is a part of. And then in Indiana, we have Indiana Cancer Consortium, and they fight for the rights of the patients. And Tiffany and I, we have done some work with both these organizations. And our goal is to spread awareness and make sure that people don't fall prey to something which is preventable and treatable.
Yeah, absolutely. And these are three wonderful organizations, like you said, and we've worked with all of them. And the goal is there's plenty of organizations out there that want to help and want to support. And so if there is any concern, whether it's anxiety about getting the colonoscopy or not understanding insurance or exactly what is colorectal cancer, just understanding what's the difference between colon cancer and the difference between rectal cancer. These are all wonderful resources and wonderful people in these organizations who want to help everyone. So those are great organizations, every single one of them.
Wonderful. Thank you, Tiffany. And like I said, remember, we a home team. You have to partner with the physicians, partner with the healthcare provider, be your own advocate, be your own navigator, ask questions, and just be safe and be well and get checked.
Absolutely.
Great. Well, thank you so much, Tiffany, for your time today. And I'm so thankful that you shared your story with us. And like I said, in this fairy tale, there is a happy ending.
There
And she lived happily
absolutely
ever
is.
after.
I did. I'm very fortunate, and thanks to you for always keeping colorectal cancer in the forefront of what you do, and allowing people like me to still be here and to share my story. I appreciate it.
Thank you so much. Well, so glad we connected, and thank you for your time.
Thank you.